Okay, we might be live. There's a period of time where it's like Zoom and Facebook are doing their thing, and we're never really sure if we're actually live. So
Okay.
here we go. But I think we're probably on right now. And
Okay.
so I'm going to go ahead and welcome you, Mary Bruno. Thank you so much for joining in. We are Cycle Power Stories here this morning, and we're here to talk about your story, your experience with fertility awareness methods and restorative reproductive health care. So would you first start off with just introducing yourself, where you're from?
Sure. My name is Mary Bruno. I am from New Orleans, Louisiana, but now I live on the North Shore in Mandeville with my husband. We've been married for 6 years and we have an adopted daughter named Isabella.
Awesome. That's beautiful. Well, welcome again. So
Thank you.
I want to start off, Mary, talking about over the next 30 minutes or so. First, let's go back. We go back a little bit to when your life was different. And I know you had some, I think, debilitating pain. What was life like at that point?
Well, it was a long time. I started my period when I was about 13 years old. And then I had, I think, some pretty intense pain then, but it just continued to get worse over the years. I also experienced really heavy bleeding, which can also be quite debilitating, considering where you are and what supplies you have. I know high school was difficult because of this. And then it continued over the years till I was about, let's see, I'm 33 now. So until about really a year ago, when I was 32, right before that, it had gotten so severe that the last 3 out of 4 months before my surgery that I had a year ago, I was in the emergency room because the pain was so bad. I was vomiting. It was so intense. And the first time I went to the emergency room, I actually feared I might die, just because there's that gap between when the doctor sees you and you actually get that treatment. And it felt like a lifetime. But I think it's important to share because women have this type of severe pain so much. A lot of women end up in the ER with pain like that. And often, they did an ultrasound, which really didn't show anything. So it's hard because you're left feeling kind of like you're crazy or so. But that's really the worst. You can't plan things around it. I have a daughter, which was difficult because when I anticipated my period coming, we would have to go stay at my mom's so she could take care of my daughter when my husband went to work. So there's all kinds of things that you have to worry about when you can't experience a quality of life several days every month.
Yeah, it sounds like you're just having to shut down for that time of your cycle, block that off, and going to the emergency room. Wow.
It's expensive. And again, last minute, thankfully we have such good friends over here and family to come pick up our daughter Bella to take care of her while my husband can help me, get through that in the hospital. I was on naproxen, I was on Vicodin, and it still was not enough. I needed morphine to get through those days.
Wow. And so were you going to your regular OBGYN and looking into this, or is everybody just kind of saying some people have this?
Well, at this point, I had maybe, I don't know, about 10 or so surgeries. I kind of lost track. The first one I had just a regular mainstream OBGYN who wanted to put me on birth control, but I didn't want to be on birth control. I didn't understand at first, the side effects or the risks, but I did my research. I considered it at first. I did my research and finally decided that it wasn't for me. I had the surgery with her and I never got on birth control. And then within 3 months, the endometriosis was back and worse. I had cysts that were bigger, and she told me that I needed to get on birth control again. And then I needed another surgery already. And that's when I really started the research, because I was just like, this doesn't add up. Why get on birth control, have the surgery, get back on birth control if the surgery is supposed to fix something? It just didn't make sense to me.
Right. So you're and I know from my background, we'll just reiterate for people listening that you can't really confirm you have endometriosis until you do surgery, right?
Correct.
So you had a surgery where they found you had endometriosis.
Correct.
Maybe we're able to remove some of it, but then how did you know it was coming back?
Well, first of all, it was 12 years before I got this diagnosis.
Yes, you're suffering 12 years of this debilitating pain. Finally, somebody did a surgery.
The only reason she even did the surgery is because I had a cyst that looked like an endometrioma. Like you said, you can't confirm it until you have surgery, but she was pretty sure I had it beforehand. And she told me ahead, she said, there could be microscopic lesions of endometriosis that I don't see, in which case it can come back and get worse. She told me that going into surgery. And she kind of said, this is what the birth control is for, to kind of preserve your fertility until you're ready to get pregnant. I, of course, declined that, which I think is why I knew that it was never fixed properly in the first place. So again, after surgery, she told me like my pain would be better after surgery, my symptoms would improve, but none of that happened. And so that's why she did enough.
I'm sorry to interrupt you, but you made a great point there about taking the birth control to like manage the symptoms, right?
Yes.
Because then, like you said, you wouldn't have known that it was getting worse.
Exactly. And there's no research to indicate that birth control limits the growth of endometriosis lesions. So a lot of women are taking it, not realizing that there is still damage being done to our fertility. And later on, when we are ready to have children, we have to get off the birth control, right? That's the idea anyway. But again, what damage has been done at that point, and you're much older at that point, and it's going to be harder to take care of the disease then anyway.
Right.
So 3 months later, she said, okay, let's do an ultrasound. And she saw a cyst she removed was replaced by a cyst 2 times as big just in 3 months.
Oh, 3 months.
3 months.
Wow.
Yeah. And this was about 7.
Powerful, Mary.
Man, I know, right? It's impressive. Well, I should say also, I've been told by neprotechnology doctors that I have a very aggressive form of endometriosis, or have had it, that is more rare, and it's more likely to come back sooner. Mm-hmm. So that's what I've been experiencing. But I was also diagnosed with adenomyosis, which complicates things as well.
Yeah, and I want to for sure talk about that in a minute. But first, tell us about the point at which, what was the turning point where you said, okay, I've got to start advocating for myself. I've got to start digging into this research and owning this. What was that like? What was the turning point?
I would say, first of all, so hard growing up in a culture that tells you this is normal. Like your pain is normal, everything is fine, just deal with it. So that's what I did. And that's part of the reason why my diagnosis came so late. And then I go to a doctor who is a very well-known, trusted doctor in my area, a very good person, very caring doctor, caring person. And I think when she first told me to get on birth control is when I really started to advocate for myself, because I didn't know anything about it. You trust your doctor, so you just want to take what they give you. She gave me some free samples that I took home, and I was like, okay, she told me to do this. I have to do this. But it just didn't feel right. And I think we have to trust our instincts. We are intelligent, confident, powerful young women. And if something doesn't feel right, we know it, and we have to trust that. And so I did some research, because it just didn't feel right. And so thankfully, that led me to listening to other people's opinions also, which is how I got introduced to Creighton, the Creighton model, and started charting actually right after my surgery, my first surgery. And I scheduled that second surgery with that first doctor, but I had about 2 months of charting, which, as you know, is about, the right amount that you need to do anything with. I sent it up to Dr. Hilgers, and they called me from the Pope Paul VI Institute to say that I could go up there to have surgery. So I canceled that second surgery with her on the day of my pre-op, which was just in time, because by the time I got up there, they said it was so bad, she would have probably just removed everything. And, you sign papers with those mainstream gynecologists saying, if I decide it's bad enough when I go in there, I can remove uterus, ovaries, tubes, everything.
Oh, Mary, so
it was that close.
You might have had a total hysterectomy at that point.
Absolutely, no doubt in my mind, no doubt. They just said it was, I needed a laparotomy after that. My first surgery after that was a laparotomy. Yeah. Yeah, for real. It was serious. So I'm so grateful. It was a blessing from God that he spared me of that second surgery, because it's because of that I've had a lot of surgeries. That's the truth, but it's because my NAPRA doctors have not given up on me. They've taken the time that is necessary to get to the bottom of a very difficult and complicated disease. And I'm so grateful for that.
Right. And so then I know you had a number of surgeries with Dr. Hilgers, where because you have such an aggressive form of endometriosis, and it really can come back. And there are NAPRA technology, there are other restorative reproductive surgeons who are very good at getting out as much as they possibly can, but your body's aggressive, Mary. So
yes, but they actually did get rid of the endometriosis. Whenever I went back into surgery, the endometriosis was not rampant. It was much better controlled. Obviously they have their special techniques with NAPRA technology surgeons. They're trained differently. The scar tissue, they call it near occasion free surgeries because of all the research that goes into to protect our bodies against scar tissue, which can cause infertility and pain in and of itself. Despite all of that, that was much better controlled, but really it was just a little bit of endometriosis. One of my ovaries was scarred down pretty well and some scar tissue, but they didn't know it yet. I had some underlying adenomyosis that was growing, which is harder to diagnose, which later on reared its ugly head. And I found out, a little bit later, thankfully.
Right. So as you're having these surgeries, has your quality of life changed at all?
Oh, well, yes, not at first. So the pain, it was helped a little bit by the time I had those surgeries up in Nebraska, but it never went away. And it was always very confusing because endometriosis wasn't that bad. When they went back in there, that was pretty well controlled. But finally, like I said, it wasn't until about, I had surgery last March, just over a year ago. I switched to Dr. Stephen Hilgers, which is Dr. Hilgers Jr. in Houston, Texas, which is a lot closer to me. So it's a lot easier. We can drive there and back from where I live, only about 5 hours. And he did an MRI. And like I said, this was at the point when I was going to the emergency room because it suddenly just got so severe. And what he found on the MRI was he called them 3 monster adenomyomas on the bottom of my uterus. My uterus was twice as big as it should have been. And so there's adenomyomas kind of formed and we're kind of taking over that part. And we believe that's what was causing most of the pain. I also had rectal pain. I had some scar tissue on my rectum. So there was some other issues going on contributing to that.
So can you explain for our listeners, what is adenomyosis with these adenomas?
Of course. So endometriosis is are lesions that can be on top of the uterus and on top of other organs within the pelvis, really anywhere. Adenomyosis is basically endometriosis within the actual muscle itself of the uterus. So typically the only treatment is to remove the uterus. It does kind of grow like a spider inside it. So those can't really be removed. And, but it also can form cysts within the muscle, which is what we call an adenomyoma, which was in the muscle of my uterus. Just 3 really big chunks at the bottom just formed, if that makes sense.
Okay, yeah, let me just clarify for our listeners. So, so endometriosis is, cells from the uterus that end up getting outside of the uterus, and they're not supposed to be there, so they cause pain and issues. But if it like almost buries itself into that, and the uterus is a muscle, so there's lots of muscle that goes around the uterus. The endometriosis gets buried into that muscle. I mean, I didn't know that about that spidering, so that's really interesting. It just implants itself in there. So thank God you didn't have that, right?
No, well, I did have a little bit of that.
Okay.
Yes, I did have a little bit of that, which he couldn't remove. And so it's possible that could come back for sure. But because most of it was isolated, that's why I was actually kind of fortunate that I had those big isolated parts.
Wow. And so he saw this on the MRI.
Yes.
Scheduled a surgery. How long after the MRI were you able to do surgery?
Oh man, it was like waiting years, because you fear those next periods coming. But I want to state also, even in that severe pain, because I understand what birth control does and is, I still chose not to be on it. And not, I understand someone that needs to get rid of the pain. Like there's no judgment here, but I just want to share, because I understand what it is. This was worth it to me to wait for the surgery. So it was maybe, it was probably 2 to 3 months from the MRI. It was just hard to get, he's very busy. So it was hard to get it in. So it was a good 2 or 3 months that I experienced that.
Wow. So he went in, removed those, and what was it like after surgery?
Well, in the pre-op, he gave us an option. Basically, he said, I can remove the uterus. It is bad enough, obviously. But he gave us the option to basically cut off part of my uterus and sew it back together. And he said that I could still get pregnant. I would just need a C-section. And so my husband and I took some time. We prayed about it. We thought about it. And I just felt, with everything that we both felt, with everything that I had been through and that we had been through, like this was important to me to have this chance. This was something new that we hadn't known about before. So it was important to me to try to cut it off. I think he said he ended up taking off 2/3 of my uterus.
Oh my gosh.
Putting it back together and said, yes, I could still get pregnant. And the beauty of that, I want people to understand, is that a mainstream gynecologist would not do that. They wouldn't take the time to do that. I would have had a hysterectomy 10 surgeries ago, but because I waited, because I had doctors that were patient and believed in me, that's why we were able to find this option. And so that along with the colorectal surgeon that came in with me, I had a little colon resection as well. And he replaced that part, or I don't understand how that works, but he worked his magic as well. He cut off the bottom of my uterus, and I woke up from surgery immediately feeling completely different. I just felt literally a weight was lifted off of me. Wow. That had never been lifted before. Like, with this kind of symptoms, there's pain in between periods too. I felt this weight that was always carrying around. And I woke up, I can't tell you, Anna, I had never felt like that. You know what I mean? So I knew something was different right away.
Wow. That's incredible. I feel like I have 10,000 questions here.
I'm sure.
I'm just so happy for you.
Thank you.
And it continues to feel better. I mean, is adenomyosis something that can come back like the endometriosis?
Yeah, absolutely. So I knew that was a risk, but I knew this would at least buy me some time, and that I knew that we would do everything that we could. That was important to me. It's possible that it could get bad again. So we're working very closely with my surgeon and my local NAPRA medical consultants, of course, paying close attention to that. But my first period after surgery was nearly pain-free for the first time in my life. So I'm still managing it with naproxen. I have a little bit of pain again, but I can manage it with naproxen and a heating pad, and I have this quality of life where I can function and do things, and I have hope, which I think is the most important thing, with no birth control, no side effects.
You're not, you can go out and do things when you're on your period. You're not in the emergency room.
I can take care of my daughter, So I can't stress enough the importance of this treatment, and just knowledge, this education that we don't really know, that we don't have to wait so long,
Yes. Yeah, absolutely. Hey, Mary, let me ask you, there's a question from one of our listeners here. Let's see. First, did you try any changes in your diet when you were doing this? And if so, what changes and why? Did anything help?
Yes, diet is a very big part of NAPRA technology treatments. The doctors are huge proponents of that, and I know that a lot of people have success with it. Man, that was hard for me. I did. Dr. Hilgers, senior, referred me to, had me start an anti-inflammatory diet by Dr. Wheel. That's the one that he gives. I was not very good at it. then Dr. Hilgers Jr., is it Dr. Young? He has a diet. Dr. Young.
Dr. Patrick.
He has, yes.
I'm sure he does. He does a lot of endometriosis.
He referred me to his anti-inflammatory diet, which I did begin an elimination diet. I eliminated gluten and dairy and sugar for a while before surgery. I didn't notice a huge change, but again, I'm not sure I did it very well. I tried really hard, but I'm just being perfectly honest. A diet is not my knowledge or my strong suit. So I was gluten-free for a while. I tried it, but I didn't find much result from that. But again, I think it's because I probably wasn't very good at it, if that makes sense.
Yeah, no, absolutely. And that's hard. Yeah.
Yeah. Well, not just hard to do. It's not that I mind doing so much. It's just the knowledge. You have to like understand the different foods that have these things in them in order to avoid them.
Yeah.
So
absolutely. Yeah. It's a whole lifestyle change there.
For sure.
Yeah. We have another question, and this is a hard question, and something that maybe we can chat about together, but why do mainstream doctors not offer these types of surgeries is what she's asking. I
know. I think look, they really care for their patients. And I want to make that very clear. They very much want to give us results. I think it comes down to medical school. There's a very limited scope of education for them. They focus on birth control and they don't go into a lot of details in the removal of endometriosis when they're trained in surgery. And you can hear that from Dr. Hilgers himself. He's been through medical school, and that's why he has this extra year-long fellowship where they can go and learn under him, because he's done all this extensive research. But I just think it's hard to believe that something as simple as like charting things that we can do at home will give us so much information. But it's amazing at how much information our doctors can get from our charts. And speaking of being an advocate for ourselves, and I don't expect everybody to do this, but, I told her about this other doctor I was seeing, and she was telling me, we do the same surgery. We do the same surgery. She kept telling me that he's not going to do anything differently than I, but she just didn't understand. And I noticed being treated by both type of doctors, it's just a very different mindset, a philosophy where she really cared about me and helping me, but she just saw me differently. Like Dr. Hilgers and what they've done, he saw me as a whole person. Like he treated me as a whole person. He understood and respected my fertility and what that connection to my whole body, my health, in such a different way. But what I mentioned, what I wouldn't expect everyone to do is I brought her his research on near adhesion-free surgery. And I said, look, I handed it to her. I'm sure she maybe threw it away. I don't think she was too keen on that, but she knew why she lost a patient. You know what I mean? And if enough women can advocate for themselves and say, no, I want more than birth control. I need more. I need you to give me more information. I need you to do some more investigation. If we can stand up for ourselves and speak for ourselves, then I think they will start to listen.
Right? Yes. Yeah, absolutely. And the more of us who are doing this, and for that listener who asked the question, there's a session in the Cycle Power Summit. Dr. Marguerite Duane from FACS is going to be talking about what doctors actually hear about in medical school and how little, you'd be amazed at how few times the phrase fertility awareness is mentioned in 4 years of medical school. So yes, like you said, Mary, understanding where they're coming from, and that, they're taught one thing in medical school, and the approach is the birth control is used to treat or take care of, A, B, C, D, E, and F. Absolutely. And it's almost everything. And so, that's what somebody's taught. It's really hard to make that change. So we're getting there. That's why we're doing this.
Absolutely. I think the more they hear success stories and that this actually works, you can't ignore that, Yeah, for sure. Yeah, absolutely.
So Mary, one last thing. I want you to share with us what you have taken your experience and felt convicted to share it with the world and advocate for people who may be going through the same thing that you went through. Tell us about taking back the terms.
Absolutely. It's kind of a passion project. I'm maybe 3 or 4 years into it right now, but once I discovered finally that this existed, this type of treatment and care through fertility awareness, specifically the Creighton model and NAPRA technology, I had to do something about it because there are so many women like me. Like the fact that it took 12 years for me to get a diagnosis is just unacceptable. And it's all because I just didn't know I had another option than birth control. Nobody, none of my doctors did any investigation into the underlying causes of my pain. Nobody asked me any questions at all. And again, that culture that we live in where it's just normal, like this is not helping our young women, at all. So I just, and I can't help but think now that had I started charting when I first started my period and had all this pain and these symptoms, I would have been diagnosed within a few months likely and tackled this difficult disease before it had a chance to do all this damage on my reproductive system. I'm infertile now. I still feel like a success because of my pain. I mean, that cannot be ignored just because I'm not able to have a child. Again, 12 years of damage to my fertility. It's hard to come back from that. Although there is still hope because I still have, the treatment I've received. So basically taking back the terms is an effort to reach young women, really women of all ages, mothers, because my mother thought my symptoms were normal as well. So it's really about awareness and education and giving women the tools to advocate for themselves and to know that there are other options. On YouTube, I've created videos that are easy to look through and share also with other people that could benefit from help like this.
Awesome. So people can find you on YouTube, Facebook, Instagram.
Yes, ma'am. YouTube, Facebook, and Instagram. Taking back the terms, it's 4 different words. So, I guess on Instagram it's not. But anyway, you could just search me, Taking Back the Terms, on all 3 of those platforms.
Cool. And what does taking back the terms mean? What do you mean by that?
Well, basically, again, I think it's this cultural idea that, women's rights, women's empowerment and choice mean this one thing that it does not. So basically, I want to take back these terms and say fertility awareness is women empowerment. We have a right to understand. Our reproductive rights mean that we have a right to this knowledge, to this option, and also to have this choice. Birth control is not our only choice. We have other options. So it's just basically taking back those terms that have kind of been used in a way that I don't think is completely accurate.
Taking back the term of women's healthcare. I love that. I love it.
Thank you.
Mary, thank you so much for joining us and for sharing your story. I know it's going to touch a lot of lives.
Thank you so much for having me.
Okay, everybody, and we're going to do a switch here. So okay. We're going to switch to our next guest. We have Lauren Vitale coming on here. Hi, Lauren. We're going to bring you in. Hello. Okay, so talk. We can hear you. There we go.
Hey, how are you?
I'm doing great. How are you, Lauren?
I'm doing really well. It's good. Thank you so much for putting this together and inviting women to share about their stories. It's so cool. I'm loving it.
Of course, you're welcome. It's fun. It's a pleasure to meet you.
Yeah, good to meet you.
So first, would you start off and just introduce yourself, Lauren? Who
Sure.
you are, where you're from?
Sure. So my name is Lauren. I'm from Michigan, born and raised in the Dearborn area, just outside of Detroit. And I'm married. My husband and I have been married for close to 11 years now. And we have 4 kids, and I'm a registered nurse. So that's basically who I am.
Awesome. So is it still cold in Michigan right now? What is it? End of April?
It's like in the 50s today. So depending on where you live, that may be cold, but to me, it feels beautiful out. So
That's not too bad.
yeah.
All right. So can you tell me about, let's just start off with your story of PMDD, which I think is not a common acronym that people hear. You tell us first what that means.
Sure, yeah. So PMDD is premenstrual dysphoric disorder. So a lot of times people just explain it as like really bad PMS, but it's a lot more than just bad PMS. With PMS, you think of like cravings or mood swings and, just a couple of days before your period. And most women have that experience right before their period starts. But with PMDD, it is more of a debilitating, actually. Anxiety, depression can be a part of it for even the whole week before the period starts, and really has more of a greater impact on quality of life for women. That's really
wow. And so when did that start? What is that experience with your quality of life? When did this start, and how did it affect you? I mean, if this is lasting a whole week, it's basically, maybe a quarter of your life, right?
Yeah. So, the symptoms I hadn't noticed for too long, actually. Throughout my whole life, I would notice bouts of anxiety here and there, and it was kind of on and off. But it wasn't actually until after, when I was pregnant with my fourth, I started to have really bad prenatal and postpartum OCD. And it kind of kept carrying into the fact when I started my cycles again. And it was so bad at the end of my cycle, like right before my period would start, that I would be in bed, just not participating in just the daily activities in my home. My husband would be taking care of the kids, and I'd just be upstairs crying and not participating. I remember it was Halloween, and the kids were carving pumpkins downstairs, and I was just like crying that I was the worst mother and couldn't carve pumpkins with them. And never to the point so badly that I was ever suicidal or wanted to self-harm, but it was to that point where I could understand how women could feel that way, of just that horrible, like, self-hatred and feeling down and beyond anything, just feeling out of control, feeling really out of control is the best way to describe it. And for a good third of my cycle every month. So I'd feel good right after my period. As soon as my period would start, I was a new woman again. I was like, I can take on the world. I can do anything now. But for that week before, it was just, I didn't want to do anything. I luckily was a stay-at-home mom at the time, so I didn't have to go to work. But had to go to work, I don't know that I could have. It was that debilitating of just the anxiety, really.
And so that is so, I can hear what you're saying about, it just like spirals out, because even though you maybe understand what's going on, okay, this is my hormones, or this is something that is wrong. This is not my head. I'm not a bad mom, but man, that just circles around so much. No, but I'm not taking care of my kids, and I'm not doing this, and I'm not doing that. And that's, wow, I can't imagine. And so what did you do?
Fertility awareness was not a new thing to me. Through our whole marriage, we had used some sort of charting to either avoid or achieve pregnancy at different times in our marriage. So that aspect of fertility awareness, the health portion of it was a little new to me. I always thought that the medical intervention part of, like, with NAPRO technology, I always assumed it was more like, well, that's for women who have trouble getting pregnant. That's not for me. Like, I've had 4 kids. I don't need a NAPRO doctor. I'll just go wherever. And I was on SSRIs for a little bit, but they had really bad side effects for me, and I knew I didn't want to continue that.
Lauren, can you clarify what that is?
Oh yes, SSRIs. They're selective serotonin reuptake inhibitors, the long name, but antidepressants. Usually Zoloft is the most common of those, and they are recommended to treat PMDD, and they can be taken just in that third of the cycle.
Okay.
But the side effects. They helped with a lot of the symptoms, but some of the side effects were the same symptoms I was having. So it actually got to a point that I was kind of balancing between, well, how bad are the side effects and how bad are the symptoms? And there has to be something better out there. And I actually, I trained as an NFP instructor, and through that started to learn more resources of places that I can reach out, and that medical intervention is not just for couples who are trying to conceive, that there are medical interventions for women like me who are suffering from this really bad anxiety in that last third of the cycle. And so I was in bed and I texted my husband and I said, you need to call this doctor. And I had him call a doctor for me and set up an appointment because I knew I just needed something else. And so I was able to see a NAPRO physician, and before this, I had mentioned it to my gynecologist, the doctor who had delivered my babies, and she mentioned the antidepressants and said that can help, or to put me on hormonal contraception to, like, stop the cycle and basically stop the symptoms from happening. And I knew I didn't want that. But going to see the other physician was such a different experience, where she asked, how was my prayer life, and was I getting enough sleep, and like asking about all aspects of my life. It was so different.
Yeah, as a whole person. Wow.
Yes. Yes. And even the fact that she wanted to investigate, well, what's the reason for it? Not just, hey, let's stop your cycles, but let's look at your hormones and see what they're actually doing. And she showed me on a graph of how everything looked, and how, even though they were within normal, and my other doctor, had she tested them, probably would have said, everything's fine, all your labs are normal. She said, well, this one's kind of high and this one's kind of low if you compare it to the two. And so she put me on compounded progesterone for me to take in that last third of my cycle. And it has changed my life. I'm a totally different woman now. It's amazing, amazing how much it has helped. My husband can't believe it either. It's crazy. I mean, I would be in bed today, actually, if I didn't have progesterone keeping me through. And it's insane how much better I feel, and can take care of my family and take care of myself and get things done and sleep at night, and just so many things that are so much under control. And even, if I still get PMS, I'm so fine with that, because I'm not so crushed down by it anymore.
Wow, that's such dramatic change with something that's fairly simple. I mean, you're taking compounded progesterone, bioidentical progesterone. I want to clarify for our listeners, which is very different from what is in the birth control pill. And I want to clarify something you said, Lauren, or just ask you about it. You made an excellent point about a lot of doctors who, and again, we don't want to bash doctors, because again, we talked about in the last conversation, and we can talk about here again, is that a lot of doctors just don't know this yet. It's coming, but they don't know about it yet. So they're taught that a lot of these, severe PMS, endometriosis, all of these conditions are treated with birth control pill. But you said something really interesting about, because this happens like during this part of your cycle, therefore the cycle's bad, right? Let's stop it.
Right.
Stop it. Let's shut it down. That's just a totally different mindset than something that says, okay, let's understand that the cycle is good, but maybe something going on in there is off.
Right.
So can you tell for our listeners, what was that like? So I think your NAPRO doctor probably did what they call a full hormone panel series in order to map your hormones, right?
Yeah. So how that worked basically was I did have to chart my cycle, which I had been doing and I was very familiar with. And at that point I was an instructor, so I was very, very familiar with it. But all of the labs were drawn after I was able to find when I ovulated. So finding the peak day. And then I had to go in several times. Now I can't remember how many times it was, but it was every 2 days after that ovulation for basically that whole time period, checking for progesterone and estrogen. And there were some thyroid hormones that she checked, and LH, FSH. There was a whole bunch of stuff that was all looked at. It wasn't fun to get my blood drawn so many times, but I was so desperate for answers that it was totally worth it. And in doing that, she was able to show me all of those hormones graphed out, and it was the estrogen and progesterone that were really important to look at, to see how they were just slightly off balance, to see that estrogen was just staying a little bit too high and progesterone was a little bit too low, and to be able to take that and then put it into actually caring for me and helping me heal.
It's fascinating that even just a little bit can make such an incredible difference to you and your life. And it's interesting that this is not something that we can say on a mass scale, like if your progesterone levels here or your estrogen levels here, then you're going to have PMDD. This is about taking you as an individual and mapping it out according to your charting and figuring out what is going to help your body to have the boost that it needs. And obviously hasn't affected your fertility at all.
Right. Exactly. Yeah. It has no effect on the first half of my cycle. I only take it toward the end after I've already ovulated. I'm still able to track my cycles and know exactly what's going on. So it's amazing.
Wow. And now, Lauren, did you have some endometriosis as well?
Yeah. Which that's another sort of, I think just everything in my life kind of figured out in the last few years, all figuring out all my health issues and finally seeing macro doctors to really take care of my health. But that's another thing that I had symptoms always from probably the time that I started my periods, you know, whether it's 12, 13 years old, something like that, and just had bad cramps. And I thought that every girl had bad cramps and that was normal.
How bad, Lauren? Would they take you out?
Not terribly, not when I was a teenager or a young woman. It would just be, I would take a few extra Motrin that day, and then just push through my day and might feel like queasy or just feel a little bit off even after taking Motrin, but able to go on with my life and live normally. But I started having babies right away when I got married and was pregnant every 2 years for a while there. So I didn't have cycles for a good, like 6 or 7 years. There was between having kids and breastfeeding. I wasn't having cycles. So I felt really good actually, just not menstruating made me feel better. But then again, after my fourth was born, I had a longer time before I had another baby. He's 3.5 now, so there's a little bit more of a gap there. And I remember every month when my cycle would come, it was getting worse. Just the pain, the cramps would be worse and worse. And other symptoms were starting up in the rest of my cycle too, beyond just around the time of bleeding, just having pain around ovulation and having sharp pains in my lower abdomen all throughout my cycle, just here and there, feeling really bloated, and just the pain was increasingly severe during my period every single month. And I brought it up with my gynecologist, and endometriosis was mentioned, and she said, you know, that I could be on the pill to help with it. And again, I knew I didn't want that. She did an ultrasound. Everything looked okay. So I knew there wasn't anything structurally wrong, but the pain continued. And so she gave me pain medicine, and so I took the stronger pain medicine, and then it kept getting worse. And I started to realize, I went to a conference where they were talking about endometriosis, and I was thinking, wow, a lot of these symptoms sound really familiar. And I know I've had 4 kids, but maybe this is something that's going on with me. And I was actually able to talk to a few women who are very public about their experience with endometriosis and say, like, I think I might have this. Like, what's your experience and what do I do now if I think that I do? And those women were able to direct me to the right doctors and get the right care and really investigate it a little more. It was sort of weird. I felt like, again, like, I have children, what, like, it can't possibly be that. I always associated endometriosis with causing infertility, and I just assumed that it couldn't be the case. And so it was an interesting perspective that I had to kind of shift my own perspective on that, to think that maybe it could be that.
Right. And so you found a doctor who went in. Did you have surgery to remove endometriosis?
Yes, I did. So the whole process, all told, when I started to kind of realize that maybe that's what it was, it only took me about a month or 2 to get an appointment with a specialist who specializes in endometriosis surgery. And then I had surgery just 2 or 3 months after that first appointment. So that was a couple of months ago that I had the surgery, and I'm already improving so much. I mean, even the first cycle after, it was, you know, it wasn't great, but the pain had already improved so much. A lot of the really debilitating pain that kept me in bed or like kept me from doing things was gone from that very first cycle after having the surgery, because it was just actually treating the endometriosis, and took it out. And it was validating too to have that surgery. And the surgery is the only way to diagnose it, because you have to actually test the samples and to realize, okay, I wasn't crazy. The pain wasn't in my head. There was something going on, and there it is on paper and actually in pictures too.
Yeah, isn't that amazing how we do? I don't know if that's worse with us women who, you know, we think maybe I just can't tolerate pain, like I'm doing something wrong, or it's my fault somehow. It's crazy.
Yeah.
Wow. I'm so happy for you. and this is happening so recently, where you just got that surgery and it's proving so much.
Yes. Yeah. And I really feel like my experience with endometriosis is unusual. I mean, a lot of women I've talked to, it's decades of pain and really like trying to find doctors and feeling like that. I don't know how it's possible that I had such a quick time taking care of it, but but I want women to know too that you don't have to struggle with pain for years. If you start to suspect something right away, go right away. And that was my experience. And luckily there was a doctor within a reasonable distance of me for having that surgery and really taking care of it. Because I know that there are women who do have to travel and then travel home after surgery, and that there should be more doctors who are able to look at women and take care of them and do those specialized surgeries. So
yes, wow, that's incredible. Lauren, I want to switch gears a little bit because your story is unique in that the endometriosis, the whatever the underlying causes of the PMDD didn't affect your fertility.
Right.
And so you were able to use fertility awareness methods, natural family planning methods to space children. Can you tell us a little bit about that? Like what, I think you've used a few different methods now.
Yes.
Tell us about your experience, just deciding on one method. Did you like it? Why did you switch to another one?
Sure. Yeah. So, gosh, I mean, in marriage prep, so over 11 years ago, my husband and I initially learned, we had a really, really short class about the Billings method. Very, very short. All I remember is smiley faces. That's really all I remember at all from it. And then after that, I did a lot of self-research, self-teaching on the symptothermal method, and did some self-study with it, and had a lot of success for several years with the symptothermal method using temperature and cervical mucus signs to determine fertility. And that helped us space our first 3 children very well. Very exactly as we wanted to. As I started to get older though, and had more kids, the cervical mucus sign became a lot more confusing. It was just really unclear to me. Temperature shifts were good, but sometimes with a long cycle, it was hard to see what was going on. So then when I was pregnant with my 4th, actually, my sister introduced me to the Marquette method, which then incorporates hormonal monitoring with cervical mucus observations as well, if women prefer to use both. And they have a really strongly supported by research breastfeeding instructions. So for those breastfeeding women where cycles can be non-existent or irregular and other signs can be hard to observe, that use of hormonal monitoring can make some things a little bit more clear. So after I learned that method, after my 4th was born, I was like, more women need to hear about this because it changed everything with breastfeeding. I was one of those lucky women just who have cervical mucus all the time when they're breastfeeding, and every day seems like it's fertile, but having the monitor to kind of double check what I was seeing really was a gift of not having to abstain for months after having a baby. So really having that changed a lot of looking into options and doing my research on different methods, and not just sticking with one just because that's what I had heard about in the beginning, but really being open to looking at what other options were out there based on phase of life.
Right. And which is hard to do in the moment because, I mean, tell us a little bit about that struggle. And I know it can be a very difficult emotional struggle of, we want to use this to space children, but they have mucus all the time. Like, what did that feel like? And plus you just had a baby, right?
Right.
And yeah. Dive right into charting right after each baby. And then why was it different with this one?
So with my first, I didn't care how close together my babies were. I was like, I want all the babies. But then after I had 2 C-sections, I had to be a little bit more conservative about avoiding pregnancy, especially right after having another baby. And after my 3rd was born, it went okay with cervical mucus and it wasn't too bad. But then I had a really confusing month, which we ended up pregnant with our 4th, which is beautiful. And like, I love him. He's awesome. But I knew that I needed to have a little bit more to look at after I had him to make sure that I could really have something that I could be confident in and confident in myself. Because what really would happen is with cervical mucus alone, you do have to have a count of 4 days of dry days. Every time you have one day where there's a change, you have to wait for it to dry up again for 4 days. At most, I would have 2 to 3 days in a row of dry. So what it would mean for me and my husband is months without being together, because there would never be 3 days in a row. And you're really trying to predict when ovulation is approaching. So anytime the cervical mucus changes, you have to assume that ovulation is approaching, and you have to assume that you're fertile. And it was just so frustrating to not feel like I knew what was going on with my body, to feel like my body was tricking me or what was actually happening. Am I fertile? Am I not? And just that frustration and feeling like I was being the gatekeeper too, that I'd have to tell my husband like, oh, well, there was cervical mucus today, so sorry. And you know, having 4 kids and feeling overwhelmed, that was a lot to take on.
Yeah. Well, I love that obviously you learn Billings, you learn symptothermal method and use methods that worked for you at certain times.
Right.
And then it sounds like, did you become a symptothermal instructor?
I actually became a Marquette instructor.
Oh, okay. So you found the one later. Okay, awesome.
Yes.
So yeah, and then you found, okay, this is not working anymore. This method's not working, so I got to find a new one. And it's just so awesome that we have all these different methods available.
Yeah. And really, I mean, looking at the same science, it's all the same information. We're looking at the same hormones and how they affect women's bodies. And we're trying to find those days where pregnancy is possible and to be creative in how we can do the research and look at what works for women's lifestyles and what works for their budget and, what's going to work for different times of life, whether they're postpartum or if they have regular cycles, women who are approaching menopause. There's something for everyone. So to not feel like you're stuck in one method. Because you're not. You can learn whatever's going to be working for you.
Absolutely. And so now, Lauren, are you taking your progesterone according to your Marquette charting?
Yes.
Okay.
Yes.
Awesome. So can you explain to our listeners what that's like logistically to take progesterone every cycle?
Yeah. So really, it doesn't require much as far as it's just requiring identifying the peak in fertility. And with Marquette, I do use the fertility monitor. And so we base peak off of hormone changes. And the monitor does detect estrogen and LH together rising. And that will indicate peak fertility. So the peak day is similar to other methods in that it's the last day of peak fertility. So with cervical mucus, we always look at the last day that there's peak cervical mucus. And with the monitor as well, we look at the last day of the peak on the monitor, and that's the peak day. They actually line up pretty well usually of cervical mucus and the monitor peak day, usually within a couple of days, which is great too. So it's not confusing. And then 3 days after that peak in fertility, I take 1 tablet of progesterone at bedtime. It makes me sleepy, so I take it at bedtime so that it doesn't affect my day. And then I take that progesterone every day for 10 days in the evening. And then usually 2 days after I stop the progesterone, my period starts. So it's just right for that, covering the worst part of those hormone crazy changes.
Nice. It's so simple. So then I imagine you have a doctor who understands how to read your Marquette chart and give the progesterone, instruct you to take the progesterone at the right time, right?
Yes, yeah. And it's great because she, she's trained in NAPRO technology. So of course, Creighton and NAPRO are together, but she knows how to look at all charts, which I think every doctor should be able to look at charts. And I know at FACS, Dr. Dwayne is very encouraging of all doctors being able to read any chart. And I think that really should be the case because there's so much value in seeing a healthy cycle mapped out, whether it's on an app or a piece of paper or whatever. And finding the peak day is really the important part. And if we're able to do that and find what else is going on in the cycle from that peak day, I really think it was a gift that I have this doctor that I was able to work with who was very good at looking at different charts and helping me with that.
That's awesome. Thank you, Lauren. So are you still currently teaching Marquette, and are you taking new clients?
Yes, yeah. I am wildly teaching Marquette, yes. I teach online classes for Marquette about once a week. I do a class. And
they're group classes?
Group classes and individual. I'm pretty flexible and I kind of alternate week to week depending on the needs of the clients. Breastfeeding women, regular cycles, marriage prep, I've taught them all, perimenopause, I've seen all the women. And my husband and I are working together on some stuff too, just helping to promote the method and help instructors really be more encouraged in the work that they're doing as well.
That's so great. So if we have listeners who are interested in Marquette teaching,
nice.
Where can they find you?
So my website is nfp.com. So it's standing for Marquette Method, nfp.com. And there's info there all about classes and all the stuff.
Wonderful. I know Marquette has just been exploding lately. I know
Yes.
Marquette instructors who are super busy.
Yes, we need more instructors too. So it's anybody wants to become an instructor.
Wonderful. Well, thank you so much for joining us, Lauren. This has been
Thank you.
to talk with you. And do you have anything else, any one key of wisdom or anything else that you would want to share with the women?
I would say find those women in your life who have experienced things that you're experiencing and ask for what they did to help them feel better. Because I know that has been a huge thing in my life, is those women that I could go to and say, hey, you've dealt with this before. What did you do? What worked? What didn't work? So seek out those women. And even if you're just commiserating, to have somebody along the journey with you to keep you encouraged in that.
Yeah, it can be lonely when we're doing this self-advocacy thing.
Yeah.
So I like that. We're here to support each other.
Yeah. Definitely.
Lauren, thank you so much for being here.
Yeah, thanks for having me.
Bye-bye.
Bye.
Wasn't that awesome? Okay, you guys listening, thank you so much for joining us. We've had Mary and we had Lauren sharing their stories. I am now going to bring on my co-host, my Cycle Power Summit co-host, Melissa Buchan. So she can say hi, and she's actually going to be talking with our next two Cycle Power story guests. So let's see, we can bring in Melissa. I think, bear with us here. Hey, there you are.
Hello.
Hi, Melissa. How are you?
Oh, I'm doing great. This is so much fun learning from these women, their incredible stories, and knowing that we're not alone in the struggle, but we're in it together, and so much power through self-advocacy and self-knowledge. I mean, wow, this is a movement. This is a movement.
It is. I know. And I could talk with women all day, because every story, even when there's similarities, like these last, like Mary and Lauren, they both had endometriosis, but their stories are so different still.
Yeah. There's similar threads, but yet so individual and so different. You're absolutely right. Absolutely right.
Well, hey, I'm going to turn this over to you. Heather is here. Hi, Heather. I've talked to you before. It's nice to see you again. But I'm going to turn this over to Melissa and Heather for you guys to chat, and then turn myself off for a few minutes. So have fun.
All right. Hey, how are you doing, Lauren?
Heather.
Heather. We've got Heather. Sorry.
That's okay.
Do that, Heather. How are you doing today?
Good.
Good. So thanks for joining us in the Cycle Power Summit. And you are going to be sharing your journey through the postpartum phase of life. Is that correct?
Yes, that's where the rubber really met the road with NFP with us. Yes.
So let's begin by, first of all, tell us what your family looks like.
So we have two boys. Right now they're 3 and almost 5. And I have a little girl on the way in September. So
congratulations. Congratulations. How's pregnancy treating you?
Never well, but I'm surviving.
Good. And where do you live?
Wisconsin.
You're up in Wisconsin. Okay, we had another northerner too. So I have to ask, how's the weather? Because I'm all the way.
Beautiful. I was worried about the lighting because it's so sunny, which is not a problem we have had this winter much. So it's finally spring. It's great.
Yeah, it's spring here too in Houston. Usually it tends to heat up quite a bit this time of year, but we still have had some beautiful weather. Okay, so you have 3 children, 2 5-year-old boy, a 3-year-old boy, and then 1 on the way, a little girl. So I would like to just first learn about your journey with fertility awareness. Have you always charted? When did you get introduced? And then transition into that journey of the postpartum period.
So I became Catholic, almost 11 years ago? I guess 11 years ago. And as part of learning what all that would entail, I found out about the that I couldn't use birth control to space and delay pregnancies. So learned about natural family planning. And once we got engaged, started learning and using it. And it was just revolutionary to be able to understand my body more. It was great. We started off with a symptothermal method called couple to couple league, and learned it together. I liked that format. It was a great format for us, especially as engaged couples. We loved it. We used it and taught it for a couple years before we had our first child, and we're very happy with it. And then we were postpartum the first time, and I went from a very regularly cycling, understandable cycle. Symptothermal worked great for us and helped me understand exactly what was going on and gave us confidence, to not knowing what in the world was going on, even though we were instructors. So I went, had my instructor training, and I worked with headquarters with my charts, and we still couldn't make sense of it. I was just about to ovulate. This was 4 months postpartum. I didn't actually ovulate until I was almost 8 months postpartum, so I was nowhere near. But the method that I was using in its postpartum teaching was just so basic that it couldn't understand what was going on with me.
Yeah, and I think it's important to understand that. Yeah, you're not fertile for an entire 4 months, or really any longer.
Well, really the 8 months, because they were looking backwards too, and it was like,
So usually, just for our listeners, it's usually a 6-day window, and so it's really finding a way to record data that you're able to interpret and understand. So, so how did you gain confidence in charting and navigating that postpartum time?
So I had to switch methods, really, because I worked all the way with headquarters, and they just couldn't understand what was going on with me. So I switched in desperation. I was looking for different methods, talking to other people, mostly online, actually all online, and kind of going through pros and cons of the various methods that were out there at the time. This was almost 5 years ago. So, and they were popular at the time, especially for postpartum. Came across Billings, and that seemed to be what would fit best for me in my situation at that point. But it was hard, because it was hard deciding to change methods. I was an instructor after all. And then it was hard to take the plunge.
And that, I understand that, because you have a loyalty, you've invested time, especially because you were an instructor. So you've invested time into this, but knowing that it may not be serving your needs at that moment. So it's okay to switch over. So are you currently still using Billings? Is that where you found your solution?
I do. Yes, it ironically, I ovulated a week later after switching to Billings.
Okay.
Yeah. Funny life. So I used it through the rest of the postpartum transition, all of those early cycles, and it really made sense of what was going on. I went through an entire postpartum time from birth to regular cycles after my second was born, and saw how well Billings, from the beginning especially, showed me what was going on.
So I want to ask for our listeners out there, so, there's so many wonderful methods out there, and I really do believe that there's a method for every woman based on what symptoms you experience and what your learning style is. What, if you can kind of get a little technical, what was the shift in going from one method to Billings that helped you gain confidence?
So step one was that I was working closely with an instructor.
Okay.
That wasn't the model as much with the other method that I even taught, where it was more, here's the book, let's have a class, and good luck, let me know if you have any problems. When you're postpartum, and especially if you're a complicated case, it helps to meet every 2 weeks and really dig into what's going on. So that model kind of difference helped. But the understanding of the basic infertile pattern, that patterns that mean fertility or infertility, that was really key for me, because I would have 5 days of one observation, and then 7 days of another, and then back to 10 days of the first one and 5 days of the second one, back and forth and back and forth. In Billings, that's very simple. But in what I was using, CCL, it just, because it never got to the magical 14 straight days of the same thing, it was apparently fertility was returning.
And that, okay, so you are really making a beautiful point here in that, I'm a fertility awareness instructor. And so it's, where are you in your reproductive journey? And so if you are a young woman and maybe not using for family planning, maybe you're single, and you want to navigate your cycles, a group session is perfect for you. You do not probably need to invest in the time or money for these one-on-one sessions. If you have any health issues, if you're in that postpartum phase, there is such a beautiful benefit to that one-on-one frequent instruction. So that doesn't mean everybody has to do that, and that's not the only way, but it definitely has a very important purpose for women who are navigating that postpartum phase.
Yes, definitely. So yeah, after my second, I went through that whole thing and saw how well it made things clear to me. And easily. It didn't require much of me in terms of my life or time or money. I decided to become an instructor because it was
great. So you were trained as a symptothermal instructor and then as a Billings instructor.
Yes.
Love it.
That is part, but yes.
Okay. And are you still teaching Billings?
I do, yes. Mostly to postpartum clients, actually. About half of my clients are postpartum.
Good. You need to teach what you know. Okay. So for all those listening, we have a great resource right here with us for that postpartum phase, because it is, and I think I've heard Anna talk about it, and I know I say it all the time too. A lady's postpartum charting is probably one of the most difficult reproductive categories to chart, but Definitely. It can be done. So working closely with an instructor, you're able to navigate your way back to normal fertility. Doesn't mean it's going to be easy. Doesn't mean that all frustration is going to be removed, but you can do it with confidence. And then it helps in that self-acceptance of, this is where I am. Why does my cycle look like this? Well, because your ovaries have been kind of quiet during pregnancy, and now they're waking up and it's time to get back into action again. That takes time. So we learn in that to be patient with our bodies.
Well, and you can be the most regular person in the world before pregnancy. And then, especially if you're nursing, I mean, it's a whole new ballgame usually. So
absolutely. Yeah, it is. Yeah. So breastfeeding naturally suppresses ovulation. So you can go 3 months, you can go 6 months, you can go a year, you can go 18 months without a return to cycle. And especially as that time frame lengthens, the cycle gets, or your charting pattern can be a little erratic. So yes, it's good to have support. Awesome. So curious, since you're pregnant, do you chart during pregnancy?
I don't know. Yeah. I help enough people with charts.
Yes. Yeah.
I take the time off. I mean, you can never really ignore what you're seeing. And that did come in handy ultimately when I had my first child, because I had my water was broken just a tiny little bit. And so because I was able to see these little changes, they were so subtle, but I said, oh my goodness, this day by day is changing. I was able to go to the hospital and know that my water was broken.
I love this so much. Again, these conversations are so beautiful because it's bringing our experience into a community. I say the exact same thing. I don't chart during pregnancy, but you can't, once you know how to, I call it living a charting lifestyle, you can't ever unknow that information. It's like riding a bike. So you're always aware, you're always making observations. You may not be documenting it in a very standardized fashion, but you still know how to interpret the data.
Yes, and it came in handy.
Excellent. That is wonderful. That is wonderful to know. That is just so much information of knowing that you can navigate. So you were able then to work through how many both postpartum phases you worked through and were able to pinpoint ovulation, or was that just with the second postpartum phase?
No, we were able to see ovulation with my first as well, even though I started only a week before. Okay. But it really seeing it the second time where I started and watched fertility slowly return, that was helpful. So yeah, I've had 2 postpartum transitions. So I'll have another later this year.
Yeah, absolutely. So then you are still meeting with clients as well?
Yes.
And so how does that look like? Do you teach in person or online, or what does your fertility awareness practice look like?
Mostly online. My diocese doesn't require NFP instruction, and I'm the only Billings instructor who teaches in English in the diocese. So maybe there's that, and maybe there's just the culture. I don't know, but I'm still trying to get more excitement in person. Yeah. So mostly it's online at this point.
And yeah, and
Also,
so you mentioned you teach. So you just teach for your diocese? Do you mostly work with engaged couples and postpartum couples, or do you teach
so in the
outside?
diocese, just a few people,
Mhm.
but online it's engaged couples from other dioceses or, like I said, a lot of postpartum women, Catholic and not actually.
And that's a great point because you mentioned this in the beginning as you were sharing your story that you came to this because you became Catholic. And it's known in the Catholic world that NFP is very popular, but it's not just a Catholic thing. And I think that it's important that we realize the truth. Like it really encompasses all backgrounds, no matter what your faith is. It's about
Definitely.
knowing your body and working with it. Now that happens to, coincide with Catholic theology, but it
I just
really,
never heard of it before.
it's just a beautiful way to live, no matter what life's, what practice
Definitely.
that you take in
I
life.
love that the word is getting out more,
Yeah. Mhm.
across the board, which is
It
great.
really is, it really is. The word is getting out. And I've been doing this for a long time now. And I've always said I've never really had to market because people just find out about me and they come to me, and I always have a long enough waiting list. But how can we get it out there more? This is why I'm so excited about the summit, of bringing all of us who are so passionate about this work together.
Yes.
And how can we really help serve the women? Because I'm sure if you're like me, you've had to turn people away. I'm sorry, I can only meet with so many people at a time.
Getting there, yeah.
Yeah. And then you're getting
Especially
ready
as
to
you have
go.
maternity leave coming
Yeah.
up.
Yeah, with maternity leave, you won't be able to take on new clients as well. So it's just, let's get our thinking caps on, and how can we really not only spread the message, I think we're doing a fantastic job at that, but then meet women where they are and serve them and help them to be confidently charting their cycles, navigating, so that they can have confidence in that postpartum phase, so that they
Definitely.
can get the help that they need if they have hormonal imbalance, or what, as we've heard with PMDD, and with just really struggling with severe endometriosis and pain. We don't need to suffer in silence. We can join together and be part of the solution.
Definitely.
Yeah. So I would like to kind of go back to this postpartum phase, because I do think it's so fascinating. And I know for me personally, as an instructor of fertility awareness, it's a difficult time working with women through this. There can be frustration. So can you speak to a bit, if we want to get technical, and to the logistics of how do you manage a lot of mucus in that postpartum phase?
Well, it helps if you start from the beginning. The most frustrating experiences can be when people come to me, and I will never say, oh no, it's too late to start working with me or anything like that. But when they come to me at, it just depends, but 6 months, 7 months, 8 months postpartum, 11 months postpartum, and they haven't had their first postpartum ovulation or period, but they're in that transition back to fertility. And they don't have any previous charting. And so we don't know what is their basic infertile pattern, or in the words of other methods, like an essential sameness pattern. We don't know what their baseline is. So we have to find that in the midst of in the midst of the craziness. That's very hard. And just, I think frequent follow-ups can help to try to do our best to find that. But in the end, if you're only a week away from ovulation, like when I switched, that might be what we find. So it does help to start from the beginning of the postpartum transition, if that's possible. Not all of us, with a new baby, it's hard to be thinking about, and being on top of, oh, and I also have to do something to know what my fertility is doing. One more thing as a mom, but that does help if possible.
Yeah. So it's building. So it kind of helps if you have experience before heading into that postpartum. But if you haven't charted before postpartum, it's okay. It's never as
right. As
said,
long as, it's just a lot easier if you start 2 months postpartum rather than 12 months postpartum.
Yeah.
In
and then
general.
finding women who are journeying in this together too, and just being supportive of each other. The charting habit and making observations can get overwhelming, but if you have other women who are going through this as well, hey, you can talk about it. I always say, if you can talk about charting your cycle, you can really talk about anything. But supporting and being confident in that we are all in this together, and it's just really a tiny shift in our mindset and in our daily habit. And it gives us so much valuable information, but it can be difficult to journey alone. So finding like-minded women, finding a supportive instructor.
Yes.
Key.
And I love that, the online community has really stepped up to be a lot of that support. I live out in the country, so I don't have a lot of local support, and specifically going through the postpartum transition at the same time. Yeah, but not really. But the fact that there is the online community with support, knowing that we're all kind of going through this together.
It makes this big world seem a whole lot smaller when we can join together in the journey. And then it really validates what we're going through as well, because this is a very different approach than what mainstream culture and medicine is teaching women. And so it's hard to get support. So finding that support system is so important.
And I think, being aware that there are other methods. I've even, to my own clients, we've troubleshooted and really thought about, could another method help more? I'm not afraid of that. I've switched methods, and I'm not afraid to encourage those who I think might be fit with a better method at this specific time in their lives.
Absolutely. And not necessarily saying it's better than the other methods, but better for you at this time in your reproductive category, reproductive time. Yeah. So what's your learning style? What do you have available to you time-wise and finance-wise? And what are you able to concentrate on and commit to?
It's the same human body, female body, but what the methods look at it from a different angle. And I think that's great.
Yeah, it's all the same basic biology. It's a basic human reproductive biology. Nothing is changing there, but there are tools and techniques based on what will serve you best in your current mode of life.
So that can help postpartum. I found it in my own experience, definitely.
Yeah. Wow. So, okay. And I think you already mentioned that you do teach online. Mostly. So where can women and couples learn more about you?
So I'm on Facebook, and I have a website. You can, if you type in Planning Life's Bumps.
Oh, how cute. I love it.
That should bring me up on Facebook or on Google. So.
Excellent. Planning Life's Bumps. That is so...
I thought about it for like a month. It was so hard to decide. I'm not a creative person, so.
Oh, I think it's so creative. I love it.
Well, it was not my idea. Somebody else came up with it. So
awesome. So much fun. So much fun. So now that you have a daughter on the way, I'm sure you're thinking, oh gosh, now I get to teach a little human all about fertility.
Yeah, I'm excited. I've done, planted little seeds with my boys, but they're also really young. But yeah, I'm looking forward to explaining to my daughter. I think my mom did a great job, but just adding this extra layer of fertility awareness will be such a great thing to share to both my boys and my girls. So I'm excited.
It's such a beautiful tool in self-confidence, building self-confidence.
And just knowledge of this is normal. Or perhaps there might be something that isn't so normal, and maybe that warrants some investigation. I think that it's just a great tool overall.
It is a great tool. Okay, so we actually have a question from one of the listeners. Is your husband involved in charting? And do you have advice for helping to get spouses involved in the charting process?
That was one thing I loved about the Couple to Couple League. You go to classes together, and the husband is encouraged to chart in various ways, like putting the thermometer in the mouth, helping to analyze the chart. I'll be honest, there was a couple years of me using Billings where my husband kind of thought it was voodoo and it was magic because he wasn't involved. I think I've been able to teach him more, and he's listened in on some of my intro sessions because those aren't confidential. So he's listened to that and picked up more, but I think it is important. So it just depends on your method, but you can definitely get him involved in helping interpret the chart at the very least, looking at the chart, if not helping make the observations, temperature, the hormone monitoring with the Clear Blue monitor. So there's concrete ways for him to get involved, but also just the interpretation and just talking about it, cycle to cycle, day by day. What are your intentions? If he can sit on the classes or the follow-up sessions, that's great too. Some or all of them, just to be involved and know that it isn't voodoo.
Yeah, I love this idea, but he can help, just a little piece of support of putting the temperature in your mouth when you wake up in the morning, if you're doing oral temperatures. That's a great idea. And, and not being too hard on yourself. Of if a husband is helping his wife chart, that's going to look like a different thing at different times in your reproductive and married life together. So sometimes it may be he attends classes. Other times it may be talking about intention or looking at your chart. And so he's never going to be as heavily involved in it as you are, but it ebbs and flows. And if he needs to take a break, maybe because he's busy or traveling or whatever the circumstance, that's okay. But knowing that that chart should always be a tool of communication, never a tool of frustration. So if it's a tool of frustration, maybe it's time to take a step back and say, why are we frustrated? And really evaluate those different frustrations. And so again, that tool of communication. And I would say if a guy can talk about cervical mucus, he can talk about anything. I remember years ago when we were just learning this, and we had attended, I think it was a group session, I'm not quite for sure, but there were a group of guys together and they were all talking about charts. I'm like, nowhere in the world will you see a group of guys talking about their ladies' charts. But they have, this group of men, the amount of respect that they had for their ladies is really
respect. Yes.
Something to be envied by everybody. It's beautiful. The amount of respect, a man who will open up and be willing to look and learn about his lady's chart. He kind of has this eye-opening experience of what her body's capable of. And she's a hormonal roller coaster. Men are pretty even Steven. If they chart, it's kind of the same thing every single day. They're always ready to go. But we ebb and flow, and men really can't necessarily connect with on an empathetic level, but they can better understand through looking at the chart. They're very visual. So if they can see the chart and then hear our crazy, they can connect the two. And it helps them to understand us better.
I think so too.
Yeah. Okay. So that's great. So he does help chart, and then the intention. So talk about that a little bit. What does that look like when, maybe a man's not heavily involved in charting, but where does he come into play as far as discussing intention?
Well, we don't necessarily talk about it day by day. Now that I'm pregnant, obviously obviously talk about babies coming and we're excited. But it's conversations here and there. Maybe it's in the context of when we have our hopefully weekly budget meetings that we have together. But just making dinner together and we talk about what can we handle. Sometimes it's obvious to both of us, we can't handle anymore right now. And so the conversation is just kind of understood. But we talk about milestones of when could we handle more, when could we be open to whatever happens. With us, that happens pretty quickly. So it's more of a, when do we want to conceive? That's just been our experience. I know everybody's experience is different, and our experience could change.
And isn't that beautiful that no matter what your experience is, it really is allowing you to come into a very important conversation. And if you can talk about this most fundamental aspect of relationships and really put that to the level that it deserves, I think it allows for greater communication and respect. And they say that couples who practice fertility awareness have a more likely outcome of staying married longer. So,
which is all of our goal.
Yeah, that's all of our goal. That is absolutely right. Well, this has been so much fun, Heather, joining in and being able to talk about fertility awareness. And you are an inspiration to me with the postpartum. It is a difficult phase. So thank you, first of all, for embracing that struggle and finding a solution and then offering that solution to other women. I think that is so beautiful, so very empowering. So if you are listening out there and you're preparing to be in the postpartum phase or you're currently in it, we have a resource for you right here. And if I know that she's getting ready to transition into maternity leave, but I'm sure that she is a wealth of knowledge and maybe she can actually point you to other people who are confident in helping women navigate through this postpartum phase. So,
Well, and I am taking clients right now, new clients, but there will come a point later in the year where I can't. And yes, I'll have to find good people. But I love talking about postpartum and the options, because there's so many options. But I love sharing what has helped me and what might help other people.
and I love that you love talking about the postpartum. There are so many, it's not just fertility awareness. And if you are a teacher, you teach it all. We're trained to teach it all, but I find that each instructor, they have kind of their niche or their specialty in the area. And so yours is postpartum. I really have a heart for couples struggling with infertility.
Sure.
And PCOS. I know women who really love helping out with the adolescent girls and teaching them as they're transitioning into their cycles. Women who really connect with women in that premenopausal time period. So yeah, we all have our kind of zone that we just are really passionate about, but knowing that we can serve women in all reproductive categories too. Okay, this has been such a fun conversation, Heather, and thank you for your time today. And I look forward to connecting with you again soon in the Cycle Power Summit. I see that Anna's joining us back. Hey, Anna.
Hey, I just wanted to pop in and say, thank you, Heather. Thanks for doing this. And we're so happy to have you here on the stories.
Yeah, I was happy to come.
All right. Bye-bye. Have a great day.
Bye-bye.
Okay, that was awesome. Thanks, Melissa. Now we have Mallory Mayer ready to come in. So I'm going to go and bring her on. And Mallory, let us know when you're there. She is.
Hello, Mallory. How are you?
Hey, I'm good. Thanks.
Great.
I'm going to go and pop off and let you guys run with this discussion. Mallory, thank you so much for joining us here for Stories.
Hi, Mallory. Welcome to Stories. So we get to talk all about you and your experience with fertility awareness. And
You know what? My internet keeps freezing up, so I don't know.
All right. Okay. So we will see. There you are. Okay. Yeah. We've got you.
I'm sorry. My internet has been a little wacky.
I understand how that goes. Internet can have it has a mind of its own and an attitude of its own. And it's like a toddler, right? It doesn't want to cooperate with us when we
it won't listen.
do. Yeah. Okay. So Mallory, your journey with fertility awareness, I would like to, before we really dig into your story with endometriosis, which is what we're going to be talking about. Can you first just let us know where you live and what your family looks like?
So I'm living in Germany right now.
Awesome.
It's about 8:30 p.m.
What time is it?
My husband's in the Army, and so it's about 8:30 p.m.
Okay.
So just finished dinner.
Winding down for bed.
Almost at the end of our day. Yeah.
That's what I love about
it. Stays light here really late.
Yeah, it's a global initiative. We are getting people from all over the world joining us, and it is such a beautiful experience to meet with these women and couples in the Summit platform. Okay, so it's evening time in Germany. So that's where you live. What does your family look like?
So it's myself and my husband, Mark, and then we have a dog named Zoe. She's a German Shepherd.
A German Shepherd.
That's us, the three of us.
I love German Shepherds. I have 2 dogs, and actually they've been very well behaved during the stories today. Usually they are barking up a storm when the Amazon man comes and leaves a package at the door.
Yeah.
Okay. And so you have had a struggle with endometriosis. So can you just tell us a little bit about what that looks like for you?
Sure. Yeah. I feel like it looks a lot different than what you might typically think of when you hear endometriosis. A lot of the typical stories are having a lot of period pain, cramps, being totally debilitated every time you get your period. And that has not been my experience at all. And I initially didn't think that endometriosis, like I was a candidate for that diagnosis for a long time. Because I didn't have like hardly painful period. Like I wouldn't even really feel like I was on my period. I would have really light periods, hardly any pain. And so I thought, well, that can't that can't be me. You know, I don't really fit the profile of endo. And we've been struggling with infertility for over a year and a half now. And I know that endo can be very much linked with infertility. But again, I was like, no, that can't be me. Actually, I have a younger sister who actually just got diagnosed with it as well. And she has more the typical profile of someone with endo. I'm like, well, I don't have her symptoms, you know? Mm-hmm. But when I started working with a necrotechnology doctor, and he's the first one that mentioned wanting to do an exploratory surgery on me to see if that was a culprit. So that was really the first time that I ever thought, okay, I guess that could be me if he's willing to do surgery on me to find out. So that's kind of like the backstory of how I came to that.
You cut out a little bit, so I missed a little bit of that. So I'm just going to clarify. So you started meeting with, you said a NAPRO physician, correct?
Yes.
Okay.
Yeah.
So he, just curious, did he have you start charting your cycles before the exploratory surgery? Or did he go right into the exploratory surgery?
Yes.
Okay.
Yeah, I was charting with Creighton before that. And so I started working with fertility care practitioner in Texas. So she would work remotely with me. And so I think we started that in July. Am I breaking up again?
No, I can hear you. You're doing okay. Yeah. The internet's doing okay. You're doing great. The internet's doing okay. Okay. So you mentioned you did not have the typical profile of endometriosis, but in your charting, something must have been a red flag that, I think that we lost Mallory. Okay.
Okay, I'm back.
You're back. Okay. So I'm just going to reiterate what we're talking about. That is okay. So I'm assuming that there was a red flag in your chart that persuaded your NAPRO physician to go through the exploratory surgery.
Yeah, I did have some markers for low progesterone and like maybe luteal phase defect. That's what my fertility care practitioner said, that could be, obviously they can't diagnose, but she said he probably will want to look for that. I did have a little bit of like tail end brown bleeding at the end of my period, which I think can be a sign as well. And also really, really bad PMS, like horrible 7 to 9 days, kind of like the speaker, a couple of people before, she was talking about that. And I was like, man, that was totally me. And so the first thing that he did was put me on progesterone injections to treat that part of it. And I was hoping a side effect would be getting pregnant, which didn't happen. But the progesterone injections did help the PMS. So I did that for a few months. And then with living in Germany, my doctor was in Texas. So I do have family that live. Yeah, it was quite, I feel like our journey has been a little slower than typical just because of how we
have a massive ocean between you and your doctor.
Yeah.
Yeah. Okay. So
it's complicated, but he was wonderful, like with email.
Good. Okay. So you went through the surgery, and how many surgeries have you had since that exploratory surgery?
Just the one. So I had, it was March 1st that I had of 2019. So just like
just recently.
Ago,
wow. Okay.
That I had. Yeah. Yeah. I just had it. And so I traveled back to Texas, and I have family that lives like 10 minutes from my NAPRO doctor. So, which was super great. So I had the surgery, and he did the exploratory laparoscopy to look for endometriosis. And he did find it in 3 spots. One of them being on my ovary, on my left ovary. And he completely removed everything. Also, they did a hysteroscopy, which is where they look inside the uterus, which endometriosis is not inside, but by definition, it's outside the uterus, but they're looking for like infections and just other abnormalities. And then also a HSG, which I can never remember the long name. I'm not even gonna attempt it, but to look for blocked tubes. And they did find that my left tube is completely blocked and attenuated. So that means narrowed, and they think it's congenital. So it was just, I was born that way. So that's what they did. And it was a really good, it was just a little over an hour surgery. And the endo wasn't very extensive because it was just in these 3 spots. I don't think I had any adhesions. And so it went really smoothly. The recovery really wasn't bad at all. Just like the first day, I get some menstrual cramp pains, and then just a little bit of incision pain. But the surgery is so minimally invasive. The stitches are, the incisions are just so tiny. It's amazing what they can do.
Yes.
Going in there. So it was a really good experience.
Yeah. So for those of us who are joining us, so we are hearing from Mallory, who has worked with a NAPRO surgeon and is receiving answers for really silent endometriosis and getting that treated. So the techniques of these surgeons are so thorough and so minimally invasive. So they really are about preserving the integrity of the reproductive organs, minimizing scarring, healing any scarring, or removing it if there was any scarring from previous infection or surgery, investigating the tubes, doing the hysteroscopies to make sure that there are no infections, that the tubes are functioning. They even have a really cool technique to look at the pressure and make sure that an egg can flow through your tube. So really, really cutting edge techniques that they are using. So now you're back in Germany and charting your cycles, I assume. Yeah.
Yeah.
And so then do you have plans to come back to the United States?
Yeah, we're still waiting on, the Army can be a little kind of hurry up and wait type of thing, but we're waiting on orders to come back. Hopefully the beginning of, or maybe at the end of this year. Nothing's really sure yet, but we'll probably be coming back within the next year or so.
Yeah. You might be able to connect with practitioners and fertility awareness providers in that area as well. It's just so fun with the summit learning where everybody is located.
Oh, yeah.
Yeah. So how long have you been charting total?
So with Creighton since July of 2018.
And were you using any other method previous to Creighton?
I was, yeah. It was a combination of symptothermal and the Marquette methods. And
Okay.
It was self-taught, like we never did any classes. My parents actually used to be teachers with CCL.
Oh,
the
this is so
symptothermal
great.
method. So that's what I was exposed to. Yeah.
You're second generation. Not many of those out there. Oh, that is incredible. I love that so much.
Yeah, like I grew up going to the conferences with them, like every 2 years, the conferences that CCL would have. It was always such a great experience. So I was, very familiar with that world of NFP.
Great.
But I basically was. Go
I'll
ahead.
connect with my teenage daughter when she gets embarrassed of like, Mom, come on. So then can you speak a little bit, what was it like then? Okay. So here you are, second generation fertility awareness charter. Your parents taught it, you grew up knowing it, and then having to switch methods. I'm sure that was that frustrating at all, or was it an easy transition?
It definitely was frustrating.
Okay.
And I don't want to scare anybody off because Creighton is amazing. I really like it now. But I thought I went into it thinking, oh, well, I'm already familiar with, cervical mucus and the way I had very regular cycles. So I was like, this is going to be easy. But just making that transition into Creighton and how detailed like the cervical mucus observations are, it felt like a whole new world. And at first, like, honestly, I wanted to quit at first. And I think it was bad timing because I started charting, like when you get your materials, you're just supposed to start. No matter where you are in your cycle, you just start charting. And I was I was in like the throes of PMS and I was having a lot of anxiety and I just was not right. Like I was just not in a good mindset. And so I think that kind of charting almost was like, almost, I don't want to say like a trigger because that's a really strong word, but I kind of associated anxiety with charting at first with Creighton. Yeah. But eventually I got over that. I started getting more comfortable with it. And then after maybe like one or maybe a couple cycles, I looked back and I'm like, what was wrong with me? Like, this is so amazing. I really love this method now. And so yeah, I think if you are like switching from one method to another.
Mallory, what you just said there, it has so much wisdom and is so very beautiful. Give it 3 months. But the fact that you came in and you made a transition during a hormonally difficult time in your cycle, and so that mindset kind of laid the foundation. Mindset work has so much to do with charting. So first we have to know why we're doing it. And so I'm really glad that you were able to recognize that and then realize that it took time to kind of overcome that initial mindset. I always say, give it 3 cycles. So no matter how you feel about it at the beginning, in 3 cycles, if you started out with kind of a negative outlook or a skepticism, I want you to evaluate it 3 cycles later. And that's exactly what you did. And now you see the benefit of it. And it was a positive experience. I always say my little mantra in life is there are no shortcuts to any place worth going. And sometimes, white knuckling isn't the best, but sometimes we really just have to get through that hard part or that transition before we can see the benefit of whatever it is that we're doing in life. But I think it applies particularly when we are charting our cycles, because it is such a different approach to managing our health, to managing our well-being, and to investigating what's going on with our hormonal health and our reproductive health.
Yeah, I totally agree with that. Yeah, now I almost have like 2 Creighton charts filled up. Like it's kind of hard to believe that it's been that long. But yeah, having that, like the goal of I'm doing this so that I can get NAPRO help so that we can overcome infertility and get the treatment that I need and all of that. So yeah, definitely having like a long-term goal in mind definitely helps.
And it's definitely the path to get you there. And it's amazing. The physicians can look at the chart, and if you chart according to certain standards, they can glance at it, and their knowledge is so deep that they are able to glean so much information from a glance at your chart. Yeah. Sometimes when we're like, he just glanced at it. I've done all this work to build up this chart and they just glanced at it. But you're building the data, and then it doesn't take them long sometimes to analyze it.
Yeah, it's pretty neat.
But it's very, very valuable information.
Mm-hmm, definitely.
Yeah. Oh, great. Excellent. So with, now having a charting lifestyle and going, you really grew. I just love this idea that you grew up with this. I'm really fascinated by it. We're going to have to chat about it sometime. But this idea that you grew up with this idea. So I'm just curious, because I think most of us do not grow up with that mindset. So what does that look like, if I can ask you, as a girl going through the time of menarche and beginning to cycle? Can you reflect back to what that kind of self-awareness felt like or looked like in your life?
I don't know. That was so long ago. I think while I knew that my parents like taught this method and like kind of had that, I don't know, surface knowledge of kind of what it was about, I didn't really ask any questions, I guess. I just like went with them to the conferences and went to childcare and, met friends. But I think I was actually a little bit like afraid to get my period. If I could be completely honest, like I dreaded it because it just seemed, I don't know, we didn't really have conversations about that, just like dinner table conversations, which I think now, having like grown up with it and then done it myself, and I'm a nurse now, and so like pretty much any topic is not in TMI for me. I think once we hopefully do have kids, and especially if we have girls, that will definitely be like a topic of conversation, even before they get their period. And because I want it to be something that you can talk about and it's not weird.
Yeah, right. And that's, I think when we are educators, and you being a nurse, you have this comfort level with the subject matter now. And it is a process to go through. I think a lot of people out there, especially if they're not a health educator or in a medical clinician or allied health provider, there is still this kind of taboo that this isn't really something that you talk about. But it's so important that we kind of break down that misconception and know that it's okay to talk about our cycles. And really, it's a very powerful tool to investigate overall health issues, to really establish and try to promote optimal well-being. There's so much, whether it be through that PMS. I mean, do you feel like, you've mentioned that you've struggled with that PMS, that 7 to 9 days of just, it's horrible, and sometimes we can't do much about it, but just even being aware that, okay, I know I'm in my luteal phase. I know I probably have a hormonal issue. Doesn't make me feel any better, but I know I'm not crazy or something wrong with me. It's just where I am. It's transitory. So there will be relief. And I find personally that sometimes if there is a difficult cycle that you have to struggle through, just knowing where you are and why you're experiencing it can help work through that. Again, doesn't make it better, doesn't make it go away. But maybe we embrace it a little differently.
Yeah, definitely. I think, and I think being aware of like where you are in your cycle and all of that, and noticing your symptoms, I think you start to realize like, this isn't normal. Like I shouldn't feel like a monster every cycle, like for almost half of my cycle, and be totally anxious, like like sometimes it would almost be debilitating for me. And like that's not normal to feel like that constantly month after month. So I think, I'm a huge advocate for people to just, even if you're not like trying to get pregnant, or even if you're not even married, like if you're single, I think that it's so valuable, because it's more than just like pregnancy or fertility. It's your actual health, because it could point you towards, like if you had endometriosis, that puts you at a little bit higher risk for cancer, or like if you have PCOS, like it affects other areas of your life than just your fertility.
Yeah, absolutely. Yeah, it's really a tool that's communicating that something's going on with our body. So it's not just about trying to get pregnant or trying to avoid a pregnancy. It's about optimizing health and knowing, if you, Mallory, are willing to fly clear across the globe to a doctor, that just speaks volumes to the power of this approach to restorative reproductive medicine, NAPRO technology treatment. And so if you are listening out there, I'm sure you don't have to go all the way across the globe. There are providers in your area, and you can reach out to us. We can help put you in contact. We have a fairly extensive network. A lot of doctors provide telemedicine. If sometimes they require one consult, if you need surgery, of course, you have to go on site, but then they can manage your symptoms by evaluating your chart through telemedicine and get you the support that you need.
Yeah.
So it goes back to this. Yeah, go ahead.
Yeah, I was just going to say it's a really amazing network, with restorative reproductive medicine and NAPRO. Like I first started investigating it through Instagram and like searching the NAPRO technology hashtag, and I found this community of women that have gone through infertility or gone through endometriosis and all these different things, and like it's a really authentic community, and everyone's just very supportive and pointing each other in the right direction, and you don't really find that very often. And I think oftentimes like the infertility space can feel so negative. And it's already kind of a negative experience. And like, if you're in a space that's negative, that makes it even worse. But I found what I've found with NAPRO, it's very, very supportive and positive.
Yeah, it's so beautiful to hear. Mallory, infertility is a journey, and it can be a painful journey. And I just want to tell you are journeying beautifully. I definitely understand that it's not easy, and I wish you all of the best of luck. And Texas, I'm in Texas too. I'm in Houston, so So excited to know that you're coming to Texas. So we have fabulous doctors in Texas. Actually, I think Texas is kind of a hot spot for NAPRO technology. So we've got a really good thing going here for all of you who are listening and interested. Mallory, thank you so much for taking time out of your evening to share your story with us. This has been so insightful, so empowering, and just so informative. You know, we've listened to stories of women who've really gone through debilitating pain with endometriosis, but there's a flip side of silent endometriosis as well, where it's really difficult to get a diagnosis unless you can find that physician or clinician who know how to treat these issues, know what to look for, and know how to resolve the issue. So thank you for sharing that. I think that so many women and couples will find this very empowering, very informative. Oh, I don't know if we've lost you. I think the screen is frozen, but that was Mallory joining us all the way from Germany. Hey, Anna, great to have you back on.
Hey, yes. Mallory, if you do come back with us, I think we lost her. Oh, there she's back.
I totally missed all that you said. I'm so sorry.
That's okay. You're fine. I just want to come back on and thank you so much. Thanks for joining us last minute for Cycle Power Stories and for sharing everything with us today.
Yeah, thank you for having me. It was a real pleasure to be on.
Okay, we'll talk to you later. Thanks, Mallory.
Okay, bye.
Bye, Mallory.
Okay, that was fantastic, Melissa.
That was a lot of fun. Wow, Anna, what great stories. I just had chills through every story that we listened to. Yeah. These women and their courage to share their story, number one, and that each story was so individual, yet that there was still a common underlying thread. Mm-hmm. And knowing that we do not have to journey at this alone, that the Cycle Power Summit is building a really strong community. And I'm just so excited for women to hear this message.
What was so cool to me about everybody's stories is the concept of self-advocacy. You know, there's at a certain point at each of these journeys where they said, all right, I got to dig into this. You know, I'm not getting the answers that I want. I'm not getting the answers that I know that I need, that I know are out there. And they stepped out and they started searching for it, whether it's asking a friend, like I think it was Lauren, you know, just asking people I know that you had this. How did you get help with that? Or seeking it out online, because this is just still new stuff. There are answers there, but it's not right in front of us yet. I know.
And Anna, and you and I both relate to that. We both were in the same shoes many, many years ago. And self-advocacy is so very important. And, you know, we talk about women being strong. That's what a strong woman does. She is a self-advocate. She doesn't take no for an answer. She keeps investigating.
Yeah, for sure. Yeah. So I want to thank everybody who was listening in with us. We had a lot of people listening in. We have part 2 of this. We talked to 4 women here this morning, afternoon, depending on where you are. We have 4 more ladies this evening. This is 6 p.m. Pacific time, so 9 p.m. Eastern, 8 p.m. Central. We're going to be talking with Anita, Megan, Elisa, and Deb tonight. So join us back here on the Cycle Power Summit page, and we have more stories for you.